Welcome back to my channel. Now today presentation is part 2 of nursing practice questions and answers about gastrointestinal problems. Now let's start with the first question of part 2. A client has just had hemorrhoidectomy. Which nursing interventions are appropriate for this client? So select all that apply. Option A, administer stool softeners as prescribed. Option B, instruct the client to limit fluid intake to avoid urinary retention. Option C, encourage a high fiber diet to promote bowel movements without straining. Option D, apply cold packs to the anal rectal area over the dressing until the packing is removed. Option E, help the client to a phallus position to place pressure on the rectal area and decrease bleeding. So the correct answer for this question is options A, administer stool softeners as prescribed. Option C, encourage a high fiber diet to promote bowel movements without straining. And finally, option D, apply cold packs to the anal rectal area over the dressing until the packing is removed. Nursing interventions after a hemorrhoidectomy are aimed at management of pain and avoidance of bleeding and incision rupture. Stool softeners and a high fiber diet will help the client avoid straining, thereby reducing the chances of rupturing the incision. An ice pack will increase comfort and decrease bleeding. Options B and E are incorrect interventions. Question 2. The nurse is planning to teach a client with the gastroesophageal reflux disease GERD about substance to avoid. Which items would the nurse include on this list? So select all that apply. Option A, coffee. Option B, chocolate. Option C, peppermint. Option D, non-fat milk. Option E, fried chicken. Option F, scrambled eggs. So the correct answer for this question is options A, coffee. Option B, chocolate. Option C, peppermint. And option E, fried chicken. Foods that decrease lower esophageal sphincter pressure and irritate the esophagus will increase reflux and exacerbate the symptoms of GERD and therefore need to be avoided. Aggravating substances include coffee, chocolate, peppermint, fried or fatty foods, carbonated beverages, and alcohol. Options D and F do not promote this effect. Question 3. The primary healthcare provider has determined that a client has contracted hepatitis A based on flu-like symptoms and jaundice. Which statement made by the client supports this medical diagnosis? Option A. I have had unprotected sex with multiple partners. Option B. I ate shellfish about 2 weeks ago at a local restaurant. Option C. I was an intravenous drug abuser in the past and shared needles. Option D. I had a blood transfusion 30 years ago after major abdominal surgery. So the correct answer for this question is option B. I ate shellfish about 2 weeks ago at a local restaurant. Hepatitis A is transmitted by the fecal-oral route via contaminated water or food or infected food handlers. Hepatitis B, C, and D are transmitted most commonly by infected blood or bodily fluids, such as in the cases of intravenous drug abuse, history of blood transfusion, or unprotected sex with multiple partners. Question 4. The nurse is assessing a client 24 hours after cholecystectomy. The nurse notes that the T tube has drained 750 ml of green brown drainage since the surgery. Which nursing intervention is most appropriate? Option A. Clamp the T tube. Option B. Irrigate the T tube. Option C. Notify the surgeon. Option D. Document the findings. So the correct answer for this question is option D. Document the findings. Following cholecystectomy, drainage from the T-tube is initially bloody and then turns a greenish-brown color. The drainage is measured as output. The amount of expected drainage will range from 500 to 1000 ml per day. So the nurse will document the output. Finally, question 5. The nurse is monitoring a client with a diagnosis of peptic ulcer. Which assessment finding will most likely indicate perforation of the ulcer? Option A. Bradycardia. Option B. Numbness in the legs. Option C. Nausea and vomiting. Option D. A rigid, board-like abdomen. So the correct answer for this question is option D. A rigid, board-like abdomen. Perforation of an ulcer is a surgical emergence and is characterized by sudden, sharp, intolerable, severe pain beginning in the mid-epigastric area and spreading over the abdomen, which becomes rigid and board-like. Nausea and vomiting may occur. Tachycardia may occur as hypovolemic shock develops. Numbness in the leg is not an associated findings.